It's a common misconception that men can't get breast cancer. However, just under 1% of all breast cancers will occur in men. This misconception possibly comes from the idea that men don't have breasts, therefore they can't get breast cancer. However, men still do have breast tissue, mostly located behind the nipple, albeit at a much smaller amount than women. The most common breast cancer found in men is invasive ductal carcinoma. This typically presents as a lump. However, there are other symptoms that men should be aware of. To help explain more about how breast cancer occurs and is treated in men, we sat down with Rick Thompson, a professor of breast cancer research and a breast cancer trials board member. We asked Professor Thompson why men can get breast cancer and how the disease can present itself.
More males have breast tissue than we think. You know, about 60% of males have some breast tissue. So as a neonate, 60% of us still have some estrogen, and so there's still some breast tissue there. It sort of drops off after adolescence because we start making enough testosterone to sort of combat that bit of estrogen that's keeping it going. But then as we age again, we start to get more breast tissue as well. But that breast tissue is sort of uniform, and and so there's things about breast cancers which are different to how breast tissue feels and looks when it's just sneaking in there, you know, because we can't combat all of our estrogen, or we're not making enough androgen, or we're making too much estrogen, etc., or having estrogen for whatever reason, or therapies that affect that axis. And so, whereas sort of normal male breast tissue is quite, it moves around. A breast cancer tends to be a firmer, lumpier thing. You might have some tissue distortion, may have some skin distortion. You may have a nipple distortion. So, you know, there is some feature, and then it's probably an asymmetry that you know would be a bit of a red flag. So you might find a male would start to have some breast tissue, particularly if he's getting older. But most male breast cancer occurs, I think the median age for male breast cancer is 65. So it's after you sort of start to you know, make less testosterone, still got a bit of estrogen in your diet, maybe you're making a bit of estrogen, so you start to get some breast tissue. So that's, you know, there. But if it feels different on one side than the other, and pain also, it can be painful. Yeah.
So that sounds very similar to how it presents in females.
Yes, I think so. It's essentially the same thing. You know, I mean, there's not enough. Male breast cancer is really only 1% of breast cancer. So it's you know, there's just not that many men to do some of the trials and studies that have been done really well in women. There's one or two, you know, there's a lot of anecdotal retrospective trials. And so because of that, and by treating it in the same way that we would treat women for female breast cancer, I think we've established the practice around male breast cancer. And generally the indications are it's very much the same disease as in women. We, unfortunately, because it's not something we're all looking out for, and we may be a bit stigmatised about it, but I think it's really that we're just not thinking that. We think, well, how can I have breast cancer? I don't have breasts, you know, but there is a little bit of breast tissue there. And so it is detected late. It's sort of not something we're screening for. We're not having the mammography screening, probably not having the self-exam. And then, so it is a bit more aggressive in males. I mean, because it's detected late, it's more advanced, and so the disease progression characteristics are a bit more advanced, yeah.
Obviously, it's men aren't. Well, some men would be, but not all men are aware that they can get breast cancer, so they're not on the lookout. So they just sort of ignore symptoms until at that later state. Well,
I think it's like the classic, you know, men's, you know, tunnel vision around prostate cancer, just worse. You might expect that they've got a prostate. Not all would, but they just don't think we've got breasts.
Right.
Yeah.
But overall, is the treatment quite similar to how you would treat a female in a similar situation?
Yeah, it's very much the same. Although all of breast cancer is ER positive, I think that or the absolute majority, and so all male breast cancer, I think, is offered tamoxifen, whereas, you know, only women's breast cancers with estrogen receptor positivity have tamoxifen. So that's one difference, but. All of the other, I mean, surgical excision is par for the course, as it is with women, yeah, most of the time. Yeah.
While breast cancer is uncommon in men, it's important for men who find a change in their breast to see their doctor without delay. As with female breast cancer, early detection and treatment are the best way to survive the disease. Breast Cancer Trials currently has a number of clinical trials open to men with breast cancer. You can find out more about these trials and how you can support our life-saving research at breastcancertrials.org.au. If you'd like to keep up to date with the latest in breast cancer research, open clinical trials, stories and breast cancer trials activity, make sure you subscribe to the Breast Cancer Trials podcast and follow us on social media. If there's a topic you'd like us to cover on the podcast with our team of experts, make sure you get in touch. And if you enjoyed this podcast, make sure you tell those in your support circles to tune in.